Tourniquets are wide bands used to compress arteries and veins to stop the blood flow to injured extremities. Tourniquets were first used during the campaigns of Alexander the Great, up until the time of World War II, where they fell out of favor because they believed they increased the rate of amputations to injured extremities. When the Iraqi and Afghanistan conflict started, they began to relook at the use of tourniquets. And what they saw was a pretty dramatic loss in life and limb due to the use of tourniquets. A death rate of what was 7% in previous conflicts had decreased to 2% with the use of tourniquets. That battlefield medicine is now translated to civilian medicine today. You can find tourniquets in almost every emergency department and on most ambulances, along with being carried by other emergency personnel, such as the police. Unfortunately, in our society today, we have seen a lot of situations that we call active shooter situations. Sandy Hook, the Aurora Theater, and most recently, the tragedy in Charleston, South Carolina. In April of 2013, the Hartford Consensus, a group of emergency medicine and trauma care experts, met to review these incidences and see how we could improve the death rate due to these shootings. One of the things that noted was that these patients were dying from blood loss. Their recommendation was to put tourniquets and bleeding kits in the hands of bystanders and the non-injured personnel so they can quickly be applied while they're waiting on the medical personnel to respond. They would like to see what we call bleeding packs placed in public places similar to we see automatic external defibrillators today in schools, courthouses, parks, and other public places. They can be used by bystanders to help. Placing a tourniquet is not difficult, and I'm going to show you how to place a tourniquet. This is a tourniquet. It's a nylon band covered with Velcro with a rod and a plastic C-clamp attached to it. What you will do is take the band and place it on the affected extremity above the site of the bleeding. You will take the Velcro and adjust the tourniquet so it is snug on the extremity. The rod, or windlass as it is known, is then twisted to apply the tension to the tourniquet needed to stop the blood flow. The rod is twisted until it cannot be turned anymore or until the bleeding has stopped to the injury. It is then placed in the plastic C-clamp here to hold it in place and keep it from moving. There is a piece of Velcro that secures it in place. You will note it says time here on the Velcro, and if the person applying the tourniquet has access to a pen, they can write what time they have applied this tourniquet, which will alert the emergency personnel. Placing a tourniquet is not difficult and can absolutely be life-saving. We will see these being placed more and more where the public has access to them. As the Hartford Consensus noted, anyone can save a life.